welcome to Health Matters, a show about what matters to your health for all the folks who live in Worcester and Central Massachusetts. My name is James Broadhurst. I'm a family doctor here in Worcester, and I'm the host for this evening, a show that is produced by the Worcester District Medical Society and WCCA TV, Channel 194, the People's Channel, here in Central Massachusetts. You'll notice I'm wearing a mask, and it does turn out that our studio has been set up so that we actually don't have to wear a mask. But you could say, out of abundance of caution, that's what I'm doing tonight. And my guests are doing that as well, because we are talking tonight about COVID. I'm going to start with Dr. Matilde Castiel. She is the Commissioner of the Health and Human Services here in Worcester. She is a colleague of mine at the University of Massachusetts Medical School and the University of Massachusetts Medical Center. She has, I think, been in the job for about 5 years, but Maddie has been part of our community, working with Latinx and Latino populations to help address issues of substance use disorders and homelessness and access to health care. So thank you so much for coming tonight.
Thank you.
And we'll get to your specific role in just a moment.
Okay.
My other guest is Dr. Robert Finberg. He is the chair of the Department of Medicine at the University of Massachusetts Medical School and professor of medicine with the University of Massachusetts Medical Center. He's been with us for just over 20 years, and he is one of the folks in our country who is leading the fight to figure out not only the best ways of treating COVID-19, but also to help figure out how to have an effective vaccine. So I'm going to start with Dr. Matilde Castiel, because she was one of those folks here in Worcester who was willing to roll up her sleeve and participate in the vaccine trial. And I wonder, Dr. Castiel, if you can talk to our listeners a little bit about that experience.
So I think for me, this is the pandemic of my lifetime, and I want to feel useful, that I'm doing something to help the community. Also, I also feel that there are lots of Latinos in the community who do not want to get the vaccine. They're very worried about the vaccine, and so we have a task force with the City of Worcester and UMass Healthcare, which is called the COVID-19 Equity Task Force, and it really looks just in the place of being able to test the community, right? Because they have the highest, Black and Latinos have the highest numbers of being exposed and being COVID positive. And so I think the idea was, and I did this with a couple of colleagues who are also on the COVID-19 Equity Task Force, to show the Latino community, communities of color, that that we're getting the vaccine, and this is what you should be thinking about also. So sort of preempting people to think about this process. But I felt good about the whole piece when I got there. I think when I talked to Dr. Finberg, I was a little hesitant initially, but then I thought it is the right thing to do, and I went ahead. And I'm not going to say I wasn't scared, but ultimately it felt good, and ultimately I feel fine, and I've not had any issues during the entire time. So.
And your experience was that you actually had the vaccine. Or
I had something.
You had something. And then you have a checkup every so often with people who are running the study.
Right, and I also have to do it through the phone and make sure that I do on a weekly basis, that I let them know how I'm feeling. And
oh, I see.
And so I check in that way with them.
So you check in actually every week to report symptoms and so on.
Right.
Excellent.
Right.
And so far, so good.
So far, so good.
Excellent.
Yeah.
Well, Dr. Finberg, I'm going to turn to you because it turns out there's been extraordinary news just in the last few days about a vaccine that has been produced by, I believe, Pfizer, with a report of very encouraging effectiveness. And I wonder if I know I'm eager for you to address that specifically, but perhaps you could step back and talk to our listeners about how is it that you go about making a vaccine to try to deal with a disease like coronavirus, and perhaps you can help us understand a little bit about the different vaccines that are in the works.
Okay, great. Because there are many different vaccines in the works, and they're made very differently. As you point out, there are something like 47 or maybe even more actually in clinical trials right now just in this country. And some of them, the traditional way, the way Louis Pasteur made his vaccine, was to take the virus and kill it. So the inactivated virus. And actually the virus that they have introduced in China, which I guess has been given to hundreds of thousands, if not millions of people, is exactly that. It's an inactivated virus. Other ways to do this are to use genetic manipulation, where you take a gene from one virus, in this case SARS-CoV-2, the virus that causes COVID-19, and you put that into an adenovirus, which is a virus that people get but doesn't usually cause severe disease.
Right.
And it expresses that particular protein, and then you make a response to that protein. So that's the virus made by AstraZeneca is done that way, and I believe the Russian virus is also made that way.
All right.
Another way, which is a newer technology, is the way the Moderna and the Pfizer vaccines. And those are actually pure nucleic acid. This is RNA. This is an RNA virus. And they take the RNA, again, in this case, both Moderna and Pfizer, it is the spike protein, which is the large protein sitting on top of the virus.
So when people see those pictures all the time of that
the thing
sphere with
out.
those things sticking out of it, that's what's called the spike protein.
Right. And,
okay.
and that's the one that attaches to the cell.
Okay.
And it's a huge protein, and obviously, if you make an antibody to that protein, the antibody will bind to it, and it won't be able to attach to the cell. So that's protective antibodies. So the Moderna and the Pfizer vaccine are made with that technology. It's just using RNA. Then you put in the RNA with a lipid vehicle that gets into the cells, and your own cells make the spike protein. And then, of course, your host, your white cells, your immune cells respond to that and make antibodies and activate your T cells.
Right. Okay. So your body then learns how to create something that will attack this spike protein.
Right.
So that if the virus now comes into your body, it will not be able to infect cells, and you won't get sick.
Right.
Okay.
So that's the theory. And this is a new technology. It's never been there's never been an RNA virus vaccine licensed yet, but we're hoping this will be the first.
And it sounds like they're encouraging results.
Our results sound very encouraging.
Right. So now I'm going to ask you to get in the weeds a little bit with us, because what we've all heard is that the preliminary data from this trial suggests that it might be as much as 90% effective. And so what I understood was that there were some between 40 and 50,000 people that were in this trial, and that they were split into two groups. And one group got a shot, which was the vaccine, and the other got a shot that wasn't the vaccine. And then they paid attention, just as they are with Dr. Castiel.
Right.
Does she get sick?
Right, exactly.
And could you tell us how it is you've got 20,000 plus people that you're looking after, and another group of 20,000. How many people got sick?
So what happens is, the original plan was to look after there were 164 people that got sick. But in fact, these studies like this, which are randomized double-blind studies, which is the most effective study to do in a case like this, where neither the person getting the vaccine nor the person giving the vaccine knows who gets it, require a data monitoring board. Because the purpose of the data monitoring board is to make sure, one, that nobody gets hurt if there are serious adverse events, and this did happen to one of the other vaccine trials. They want to make sure if there is such an event, it doesn't relate to the vaccine. So two of these trials were actually stopped for that reason because they wanted to make sure, and they did make sure that then they started them again.
Right.
So the data monitoring board, the other thing that the data monitoring board does is to look at the data, because I can't see the data as an investigator. Pfizer can't see the data as a sponsor because it's double blind. The data monitoring board can see the data.
Right.
And they want to look at it, and if they decide, and they can decide this really at any time based on their knowledge of the numbers, that it would be futile to go forward, they just stop the study. In
So
this
that's the point,
particular case, they looked at 94 patients, actually.
Okay.
And of those 94, 90% of them were in the placebo group, which is a fantastic result, because that suggests that the vaccine was very effective.
Right.
So very few vaccinees got the virus.
Got sick with the virus.
Got sick with the virus.
And one of the tricky parts that I guess is, we all know that this is a tricky virus, and it's a novel virus, and all of us as physicians are trying to understand it better. But there are an awful lot of people who seem to get the virus, become infectious for the virus so they can spread it, but they never get sick.
Right.
And would those people be identified in this trial, to your knowledge?
No, probably not, because as Dr. Castiel pointed out, the way this is done is you follow up people, you ask them if they have symptoms.
Right.
If they don't have symptoms, we wouldn't know that they.
I see. So, Dr. Castiel, let's come back to you for your experience here. I know that the way that tests work to actually find out if somebody's got the virus right now is typically a swab that goes in the nose, or maybe using saliva. Do you have to have those kinds of tests for this trial?
So I've had, yes. So when I go for my checkups, that's what they do. They'll do the nasal swab, and they do blood. So I'm assuming that's also for antibodies.
Okay, all right. Well, I'm delighted that you're feeling well, and that so far so good.
Right.
Let me, you talked a little bit about this vaccine, but it's not the only vaccine that is sort of on the radar in our community. We've had flu vaccines for years and years and years. And should people, I mean, are we going to worry about the flu this year, or are we just worried about coronavirus?
I think we always worry about the flu, and what you don't want is the flu and the coronavirus together. But the fact that we all are wearing masks, and that we all should be wearing masks, is also protective against the flu too. But just in the case that we don't want people with COVID and with the flu, we want everybody to get the flu vaccine. So we've actually, again, part of our task force have partnered with UMass, and really have gone out when we do COVID testing to stop the spread. We have, pharmacy Walgreens comes out and does the vaccines for the flu for everybody there.
Is that right?
Yeah,
So
they've been incredible for that.
In our community, if you hear about testing for this coronavirus and you go and you haven't had your flu shot yet, you could get it right there.
Right. And I think right now UMass is actually doing them on their own. So we did it probably since August till most recent. And I think UMass is doing it on its own now.
So could you remind our viewers where are the place? First of all, now's the time to get the flu vaccine. We're in the middle right now, actually in November. It's been available, but have we seen much circulating clinical flu illness in Massachusetts yet?
So I know that there's been some at UMass, and so some that have been hospitalized with the flu. I haven't heard that there's a huge epidemic of it right now, but that's the whole piece and that could be partly this, the masks, and so. But there have been people who have been hospitalized, and that started probably about, I want to say, a month and a half or 2 months ago that people started to get hospitalized with it.
Wow. When I think about flu season, I tend to think that it's maybe gets going in December and it really revs up in January and February. The key is it's not too late
Absolutely.
to get your flu shot.
Absolutely.
And where are the different, we've said that at one of these
Stop the spread?
stop the spread programs that are coordinated, I think, by the Commonwealth of Massachusetts,
Correct.
but happen in our community. We can do that. Where are some of the other places that a person could get a flu shot?
So, of course, you can go to your primary care, to your doctor,
Go
to
to
the
your doctor.
hospital to do that. You can go to the pharmacies. CVS, Walgreens also has
Right.
the flu. So there's plenty of places that you can get access to, along with some of the sites that Stop the Spread has been going with in Worcester.
Okay, all right. I think what I'd like to do is to get some insight from you, Dr. Finberg, about treating this disease. But I'm going to stop for just a moment and remind our viewers that you're watching Health Matters. I'm here I'm James Broadhurst, and I'm here with Dr. Castiel, the Commissioner of Health and Human Services for the City of Worcester, and Dr. Robert Finberg, Chair of the Department of Medicine at the University of Massachusetts Medical Center and School. And we're talking about COVID and flu. And Dr. Finberg, we in Massachusetts have looked at numbers of new cases that have been on the rise. And actually today, as I was driving here, I heard for the first time in a long time, we had over 2,000 new cases reported by the Department of Public Health. Now, that's an astonishing number. I mean, that's the numbers that we were seeing back in April and May. And frankly, many, many people were dying. And many, many people were getting very sick. What impresses me is that the number of deaths in Massachusetts has seemed to be surprisingly low, which suggests to me that we're getting better at treating this disease. And I wonder if you could share some of your insight and expertise, for our viewers, if they hear that either they're positive or a family member or a relative, what can they expect from the doctors in terms of what are the important things for them to look out for, when should they go to the hospital, and what kind of treatments are available?
Okay, that is a complicated question because this is a complicated disease.
Right.
And I think, as you mentioned before, a huge percentage of people, particularly among younger people, are completely asymptomatic. And part of the reason there may be more cases now is that many of the cases we're seeing now are in younger people. And that may be for a lot of reasons. There's some evidence the virus may have changed and may be less virulent, although that's debatable. However, people that are older or have certain underlying conditions, diabetes, obesity, severe kidney disease, and other underlying diseases do much worse. So if it's in a younger population, they may be much more, and children are much more likely to be asymptomatic. However, they can certainly spread the disease. Right. So I think that's part of the issue. In terms of treatments, I do think there are treatments now that we did not have before. That's true. I think that at least two large multi-center studies showed in the U.S. that remdesivir, an antiviral agent, does have an effect on ameliorating disease. And the British study on dexamethasone shows that particularly in severely ill people, that steroid has an effect. Now, in terms of what people should do, obviously if you're asymptomatic, what you should do is be careful about not infecting vulnerable people, particularly the elderly. Just like with influenza, the elderly, some people over 60 have hundreds of times the risk of death as compared to younger people. So that's very important. Nursing home epidemics are deadly. So that people who think they may have acquired the disease, even if they're asymptomatic, should certainly be careful about wearing masks and social distancing and good hygiene to avoid spreading it to other people. In terms of when should you see a doctor? Well, high fevers, shortness of breath, evidence of cough, these are reasons to see a doctor because the disease can be life-threatening even in younger people, and there are treatments, a variety of treatments that are available at the moment.
So what you would expect, if you learn you're positive, your doctor may already know, or maybe not, depending upon where you had your screening test. So I guess you should call your doctor.
Yes, certainly. Right? I mean, obviously you should, because your doctor knows what medicines you're on, what conditions you might have, so that's very important.
So I'm now going to turn to Dr. Castiel as an internist. You get a call from somebody that, gosh, Dr. Castiel, I've just learned that I'm positive for this virus. What are you going to tell them about isolation, about quarantine? Can you help us understand what's the difference between an isolation situation and a quarantine situation?
Well, I think the goal is to be able to be on your own. And so most of the people that I work with, which are homeless or people who are in group homes, aren't able to isolate, to be on their own or have a space on their own to be able to quarantine for the 14 days. And so what we end up doing is, if you can't quarantine, there are hotels that are put out by the state that you can send this, our patients over there to be quarantined for the 14 days because they are unable to isolate. But the goal is to find a room if it's a family member, if you can find a room in the house where that person can stay, and making sure that everything is clean, that food is, put in in paperware and left there for them. One of the things that we do in the city, which I think is wonderful, is, if we tell somebody to quarantine, it's our responsibility to feed you. So we take all the positive tests in the city and we offer to bring food to their homes, the entire family, so that they're able to be fed, because we don't want them going to the grocery, we don't want them going anywhere.
That's right.
So, so that's some of the things that we do. But finding a place where you can isolate and really not be around your family or anybody else.
And I'm sure that our listeners may have the sense, when they hear about isolation and staying in a room, you tend to think of a house by itself with one family in it. But the reality in our city is that there are many. We're the city of triple deckers, right. So we've got many houses that have 3 units in them, and of course many more, and folks. But how can people access that kind of information? Do they call?
So the Red Cross is where you would call, and they would, and you tell them that you're unable to isolate, that we don't have a spot in the house that the person can isolate, and then they can help you through that process.
Great. So they could link you with other resources.
Correct.
All right. Well, thank you. Now I'm going to turn back to Dr. Finberg, because I'm now going to say we've got this individual. Sadly, they may have some complicating conditions. They might be overweight. They may be have diabetes, whatever. But now they're not doing well, and they're short of breath. They're now, I think, in the hospital. Well, you mentioned the nursing homes. In the flu arrangement, as a primary care physician, there are some medicines that I could prescribe to people that will actually prevent, hopefully, them from getting flu, or maybe help them not have such a severe flu. Is there anything available for the coronavirus that can do the same thing?
Not at this point, although I would like to think we're going to find some things in the near future. But
right
now we don't have prophylactics.
So given that we don't have that, it is that much more important to be wearing masks, to be doing the social distancing, to try to, because the key is to not get it in the first place. All right, but now I've got it. I'm in the hospital. You're taking care of me, if I'm lucky. What are the kinds of things? You mentioned remdesivir is a medicine.
Remdesivir is a medicine that attacks the virus. There are, for people who are less symptomatic, monoclonal antibody therapies, which are being given mostly to outpatients, but sometimes to people with moderate disease. And then there are several clinical trials of new drugs that look like they may be effective.
But those strategies that you just mentioned, they are experimental still. These monoclonal antibodies?
True. Yes, that they are experimental.
Can you briefly help our listeners
understand?
understand?
So a monoclonal antibody is taking a single antibody, which is a protein made by one of us in response to a virus, that's manufactured and brought up to large concentrations, and then actually infused into the person. And there is some positive data to say that will neutralize the virus.
Wow.
So it's encouraging.
It is. So there are some experimental treatments that are out there.
Right.
Could people in Worcester be treated with an experimental, or is this so restricted that it really wouldn't be available?
Absolutely. Those experimental therapies are available. The other experimental therapies that are available for people who have serious disease are so-called immunomodulators, things that turn down the immune response, because COVID-19 is a biphasic disease. It starts out with the fever and with the body's responding to the virus, but later on, sometimes after the virus is gone, that immune response is destroying the person's lungs and other cells, so it's destructive. So the immunomodulators, which are like the steroids, dexamethasone, turn off that response, and there are experimental therapies for that as well.
Well, Dr. Castiel, I'm going to turn to you for the last word here, as we're running out of time. I wonder what advice you would have to our city about fundamentally what can we do?
I think the most important thing that all of us can do is this, is wear the mask. If everybody could wear the mask, the amounts of lives that we would save would be dramatic. And we all need to protect one another. And this is it. And during the time that we have it, till the vaccine, till every person has the vaccine, this is it, hygiene. And social distancing is the most important thing that we could do.
Well, thank you kindly for joining us for our show this evening. I know we've run just to the edge. I'm Jay Broadhurst. Thanks to Dr. Matty Castiel and Dr. Bob Finberg. And we'll see you next time on Health Matters. Thanks to our engineer, Frank Rocco. Have a great evening.